The first episode of House is about a 29-year-old preschool teacher who has a seizure in front of her class. The seizure seems to start in Broca's area, which progresses to what I think is supposed to be a tonic-clonic seizure, but looks like this. She's just arching her back and wiggling her wrist. After she has this initial seizure, it's not really clear what happens to her. All we know is that she's been in hospital for a month. Nobody really says why, just that she had
progressive deterioration of mental status.
Whatever that means. So most of the time that we see the patient, she looks pretty good. That's the first mistake that the show makes. Hospital patients never look this good. So a month has passed now, and Wilson, the patient's treating doctor, finally comes to House, who's a diagnostician, a specialty that doesn't exist. He doesn't mention at all that they've scanned her head, which I feel would be a very important detail to mention. The thing that he does choose to mention is that they've tested for tumour markers, which are negative. Not a very useful test when you can literally look inside someone's head with a scan. Then Wilson says something really dumb.
And she's not responding to radiation treatment.
This is so dumb. You can't start radiation if you have absolutely no idea what's going on. And when someone's had a month of radiation, they certainly don't look like this afterwards.
I am the senior reactor control chief engineer at Chernobyl nuclear power plant.
It's a lesion.
Now, I had a really good look at the scan and there's nothing there. Everything that I think might be something just turns out to be House's face. The reason that this bit's stupid is Foreman's a neurologist. He literally only deals with the brain. I don't know what lesion he's talking about, and then House later says that there's nothing on the CAT scan. You'd think that if Foreman says this, he'd probably back up his statement by pointing out where it is or, arguing with House, but he just doesn't say anything. The other really funny thing to mention is that this is an MRI, not a CT scan. This is clearly a mistake because we later see the team nearly killing her while trying to MRI her head. For the sake of argument, let's suspend belief and pretend that this MRI is actually a CT, and that doctors don't always look like they haven't showered in weeks.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Yeah, this is a pretty badass thing to say, except House already has most of the history from Wilson, and he also has a scan of her head, so he doesn't necessarily need to talk to her.
That's cheating.
Cheating! It's a jigsaw puzzle! You can't cheat!
Now this is the fun part where the team goes through some differential diagnoses.
aneurysm, stroke, or some other ischemic syndrome.
Get her a contrast MRI.
Yes, I agree. This could cause her presentation and does warrant an MRI with contrast. But she's been in hospital for over a month with no diagnosis, and they haven't thought to do an MRI yet. They also never again mention the fact that she might have had a stroke.
Creutzfeldt-Jakob disease?
Mad cow. Mad zebra.
This one's possible and also needs an MRI and possibly a biopsy, but they seem to forget about this one too.
Wernicke's encephalopathy.
No. Blood thymine level was normal.
Lab in Trenton could have screwed up the blood test.
So Wernicke's encephalopathy is a neurological problem caused by thiamine deficiency. It only tends to happen in alcoholics, and they talk about her thiamine levels, but they could have actually just tried giving her thiamine. Also, it doesn't present with seizures, and it also doesn't present this acutely. She also has no risk factors for it, but of course her thiamine levels are normal and House's response is just test it again. Guess what? They don't mention this one again either. In fact, they forget about all of the differentials that they just mentioned, and go back to thinking that it's a brain tumor again immediately after, making this whole section a completely pointless exercise. So Foreman and Cameron are getting the patient ready for her MRI, but I guarantee they wouldn't know how to do this. There are people called radiographers who study an entire degree just to run these machines. So anyway, House gets his authorization pulled and they have to take the patient out of the scanner. Imagine being that patient, being told that your doctor isn't allowed to scan you anymore while you're in the scanner. Like, I would just get up and leave the hospital. There are also 3 other doctors right here. Why can't they just order the scan? So after House has successfully built up some more sexual tension between him and Cuddy, they're finally getting the MRI scan that she should have had a month ago. So unfortunately, Rebecca goes into anaphylaxis from the gadolinium on the table, but she isn't in much distress at all. I mean, if I couldn't breathe, I'd probably be thrashing around the table.
Rebecca.
She also sounds like she's choking rather than stridering. I mean, if you can't breathe, you don't make choking sounds, you make the sound of somebody gasping for breath. Anaphylaxis seems to be dramatized quite a bit on TV. It looks pretty severe, pretty quick, but you probably would have noticed her face swelling up or something else happening before she gets to the point where she can't even breathe. The team jumps into action, and luckily, they're all superstars at advanced life support. They don't do the first thing that anyone in that situation would normally do, which is to call for help. Cameron can't ventilate with a bag valve mask, and Foreman jumps in to try and intubate her, but he's trying it from the side of the bed, which would make it very difficult to see. He should be standing at the head of the bed, but he gives up quickly and they go straight to his surgical airway. Yay, she's alive. But unfortunately, now they can't do the MRI. Except they totally can. They just, for some reason, don't think to just do it without contrast. Now, I will admit that a contrast MRI is much better than a non-contrast one, but if that's all you can do, you would just do that. Finally, about halfway through the episode, House considers vasculitis as a diagnosis, which is probably the most likely thing to cause her presentation. Unfortunately, the treatment for vasculitis is a whole new source of drama.
Steroids. Give her steroids.
Alright, before we get into the drama with the steroids, I will tell you that everything is treated with steroids. You can give steroids for almost everything, and I guarantee that if they thought she had a brain tumor, which they did, for over a month, she would already be on steroids.
Why steroids?
It's part of your treatment.
We're just trying some alternative medication.
Steroids aren't an alternative to radiation.
The tests weren't really conclusive.
We're treating you for vasculitis.
For absolutely no reason at all, Chase decides to lie to the patient about the steroids. If they were totally upfront with her and just said, we want to try steroids to see if you get better, any reasonable person would have been like, whatever. Also, can I just point out that she's still getting radiation therapy? To what?
First of all, there's nothing on the CAT scan.
There's nothing on the scan. I don't know what they're irradiating. So now Foreman goes to her preschool, and later on goes with Cameron to her house to snoop around. You don't need to have any sort of medical background to know that no one would ever do this.
Hi, doggy. Psittacosis can lead to nerve problems, neurological complications.
Now Foreman thinks that she has something called psittacosis, which is also called pigeon breeder's lung, because they have a bird at school. She has none of the features of that disease, and his reasoning is that it can sometimes cause nerve problems, something, seizure, I don't know.
Why are you giving Adler steroids?
She's my patient. That's what you do with patients. You give them medicine.
You don't prescribe medicine based on guesses.
Yes you do. All the time. That's all medicine is. It's just educated guesses. Also, they've been giving her radiation based on guesses. I would choose guessing with steroids over guessing with radiation any day. Cuddy is the boss of the hospital. How come she has time to go around and cross off the prednisone? She's hired House because House is better than her. How come she's questioning his judgment and saying that he's wrong when she doesn't even know the case as well as him? Cuddy storms into the room to cross off the prednisone but sees that the patient's getting better. But then again, what even are her symptoms? She just kind of sits in bed looking sad, but now she's looking slightly less sad. Now comes the dumbest scene in the entire episode.
I can't.
Alright, so she goes totally blind, then she has this seizure, which I don't know what to make of this one. She also has telemetry on for some reason, so normally they wouldn't be monitoring her heart rate, but they are at the moment. Wilson puts her on her side, which is the wrong thing to do. She then goes into ventricular fibrillation, and then she flatlines. First of all, total blindness before a seizure is very unlikely to happen in the condition that she has, because of the way the visual tract runs. Just take my word for it. My second point is that seizures don't cause cardiac arrests. The brain simply doesn't connect to the heart like that. Maybe if the telemetry showed something before her symptoms, then she could have had some sort of hypoxic trigger for the seizure, but clearly the brain stuff happened first, then the heart stuff. Contrary to popular belief, you can't shock somebody who's flatlined. The medical term for flatlining is asystole, which is a Latin word that means heart no worky. When you flatline, you're dead. That's it. The rhythm here is called ventricular fibrillation, which is a shockable rhythm, but that stops. What's most likely happened here is that Wilson's later on her side, she's jolted around the bed and unplugged the telemetry. She's just unplugged the monitor and that's it. Somehow they managed to shock her back to life, which is great. Except now she's worse, and they don't know what's going on.
Given the latest symptoms, it's clearly growing deeper into the brainstem. Soon she won't be able to walk. She'll go blind permanently, and then the respiratory center will fail.
Where is he getting all this from? Foreman is the worst neurologist ever. He's prognosticating exactly what's going to happen to her when he has absolutely no idea what's going on. He said it's invaded the brainstem, but what he was testing before was higher processing, which happens in the frontal lobe, not the brainstem.
We're just gonna watch her die? Yeah. We're gonna watch her die.
It's completely beyond me why they've chosen to not repeat the scan when she's clearly getting worse. You notice that all of the decisions that they make, they don't involve the patient at all. The patient doesn't consent to it, and who the hell would consent to stopping all treatment and just seeing how quickly you die? It's crazy.
I need 36 Vicodin in change for $1.
I'm really confused what happens in this bit. He just asks for Vicodin, and then he just swaps them with mints. How come she just leaves them on the counter like this? And like, does he need a script or something? I haven't worked in America, but I'm pretty sure you can't just ask for opiates and they just give them to you.
Exam room 2.
Yeah, real sneaky House. I bet she didn't hear you slam those pills down on the table.
Exam room 2.
So House gets to the final diagnosis for the case. As the old saying goes,
Where there's ham, there's pork. Where there's pork, there's neurocystic sarcosis.
did you pick it? House then goes on to explain that neurocysticercosis is when you have this particular type of worm that reproduces in your bowel, can get into the bloodstream and go to your brain. Chase then decides to ruin the whole episode and say this.
Reproduce? There's only one lesion and it's nowhere near her bowel.
That's weird. I distinctly remember hearing,
First of all, there's nothing on the CAT scan.
It's a lesion.
just make up your damn mind. That's probably what's been causing all of her symptoms, and why were they not investigating that further by, scanning it more, getting a neurosurgeon to cut it out? I don't understand why they just ignored this and they thought of all of these diseases that don't cause lesions on scans. So they've solved the case, but there still isn't enough drama in the episode, so they come up against this.
I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
Which is fair enough considering everything that's happened to her, except she also doesn't know that they've solved the case. Look how sad they are, but they haven't even talked to her about it. House finally gets the balls to go see the patient and does a terrible job.
You're being an idiot.
Good job, House, that'll really make her want to stay. House explains to her that he thinks she has a tapeworm in her brain, to which she says,
You were sure I had vasculitis, too.
House never says that he's sure that she has vasculitis. He even has an argument with Cuddy about how he's just guessing. So House calls her an idiot, and surprisingly, she still wants to discharge against medical advice. Frustrated about her not complying, the team then tries to take away her rights.
Maybe we can get a court order, override her wishes, claim she doesn't have the capacity to make this decision.
She does.
I don't think that she technically does. The thing is, she needs to be making an informed decision about this, and it sounds like she hasn't been informed properly about what the treatment is. So because of House's character arc, he's now allowing this woman to discharge against medical advice and go die in the community from a very treatable condition. Since she's leaving because there's no proof that she actually has a worm, Chase comes up with a brilliant idea to just x-ray her leg. I have 3 points to make about this. Number 1, how come she's refused all further testing, but he thinks that she'll agree to this x-ray? Number 2, she hasn't had any symptoms at all in her leg. Why are they x-raying her leg? Number 3, why don't they x-ray her head? Proving that she has a worm in her leg won't prove to her that she has one in her head. If it's proof that she's looking for, then you would scan her head. And why can't they just do the non-con CT scan again? This little animation shows that the bug is still alive in her leg, but realistically it would only show up on an x-ray if it's dead and calcified. Since there are still no nurses around, Chase gives her a medication which she finally agrees to take. Yay! And she lives happily ever after. I think the important lesson that we've learned today is just remember to take all of your drugs, kids. Thus ends the pilot episode of House MD. I'm sure there are many other mistakes that I missed. I did gloss over quite a few things, like for example, how poorly this hospital's run, the fact that House and his team are being paid to only take on a single case at a time, They break into houses, they get lunch breaks, and some of the language that they use is a bit... Anyway, let me know what you think and whether you want to see more videos like this. Cheers.